multiple pathologies can develop over there. And resultantly, when the lungs are affected, the respiration becomes affected. The person immediately becomes ill. Now, respiration can be voluntarily stopped, of course, for some time. It can be slowed down, or it can be accentuated, means the rate of respiration can be increased voluntarily, but all these are for a limited time. Though some blood gas changes definitely develop after these efforts. If somebody does not want to respire, he can hold his breath for some time, hardly a minute or so. Similarly, voluntarily, they can increase the rate of the breathing. Instead of 14 breaths per minute, they can increase it to double or triple. Or they can voluntarily develop slow rate as well. But that will be for the limited time. It's not the ailment then. There are pulmonary irritant receptors and J receptors which are prone to stimulation easily. Lungs have got three types of the receptors. One is the stretch receptor. As the name indicates, they are stimulated when there is overinflation of the lungs. And this is helpful because when you inflate the lungs too much, they can be damaged. But you cannot reach to the upper limit because the receptors are stimulated and there is abrupt cessation of the inspiration and immediately expiration starts. This is called Herring-Breuer reflex. Herring-Breuer reflex. Similarly, there are irritant receptors which are situated in the bronchi, in the bronchioles, in the lungs. When stimulated by obnoxious material, they cause reflex tachycardia as well as, tachypnea as well as cough to remove the irritant. Then apart from them, there are J receptors, as the name indicates. J means juxta, near. These are the receptors in the alveoli near the capillaries. And whenever they are stimulated, they are usually stimulated by accumulation of edema fluid in the lungs. So the person feels extremely uneasy when J receptors are stimulated. Rest is not known about their function. Throughout the pulmonary system, the receptors are situated like trachea, bronchi, bronchioles, alveoli even. And as I told you, these on stimulation can cause cough, they can cause sneezing, and ultimately, if they are repeatedly stimulated, they can lead to asthma, which is a disease we shall discuss later in the session. Then respiration can be affected. The rate of respiration and the depth of the respiration can be affected by some changes from not in the lungs but in the brain. The brain damage may affect respiration because there are centers in the medulla oblongata for the respiration, and when damage to these parts occur, your respiration can be affected, means your lungs can be affected. Anesthetic agents or phenobarbital, which is a sedative drug, or anesthetic agents which are administered to the patient while performing surgery so that they get anesthetized and they do not feel pain. These agents are called anesthetic agents, and they also can change the respiratory behavior. They may usually they suppress the respiration and sometimes may stop it altogether because of the effect over the brain centers. Similarly, opiates, opium eaters, they are also prone to respiratory problems because of the suppression of the respiratory centers in the brain by opium. Now, lungs can in general be affected by bacteria, by viruses, by fungi. Similarly, the lungs can also be affected congenitally. For example, a baby might be born with a collapsed lung. That's a congenital defect, usually due to deficiency of a surfactant. So that is the congenital diseases of the lung. Otherwise, all the other diseases are acquired, like the infections. When respiration is affected, it can be affected in so many ways. One of the type is the periodic breathing. As the name indicates, the breathing is not in a regular rhythm. Rather, it is periodic. Sometimes more breathing, sometimes less breathing. When the patient becomes apneic, apnea means cessation of breathing. Apnea, cessation of breathing. So in periodic breathing, what happens that the breathing becomes slow due to some defect. Resultantly, there is increased accumulation of carbon dioxide in the blood, which cannot be eliminated properly. And there is also poor oxygenation. This causes stimulation of the brain center by the high quantity of carbon dioxide accumulated, which results in hyperventilation. The rate and the depth of the respiration increases. Now, this is step one and step two. In step one, the respiration got slowed down and the person was respiring slowly and less deeply. But when stimulated by carbon dioxide accumulation, they start breathing with a high rate and with the deep respiration. So this is the periodic, this period is repeated again and again, and this is the periodic breathing. One of the examples of the periodic breathing is the Chain-Stokes breathing. Chain and Stokes, they were two physicians, probably they were Irish. They noticed it and gave the name Chain-Stokes breathing to such type of periodic breathing. This Chain-Stokes breathing usually happen in the brain damage, and when it starts, it's a bad prognosis. This is not, this is something serious for the health. The patient's damaged brain, the respiratory center cannot be normally stimulated by the carbon dioxide unless carbon dioxide accumulates too much. The normal stimulation of the brain centers by the small quantities of carbon dioxide that is dampened, they have to be stimulated. The threshold level increases of the brain center, so much carbon dioxide has to be accumulated to stimulate them. And when there is sluggish respiration, there is constant accumulation of the carbon dioxide. When it goes too much high, then it causes increase in respiratory rate as well as in the depth of the respiration. So there is waxing and waning of the carbon dioxide of the respiration. Waxing and waning means that there is slow decrease in the respiration. Ultimately, it causes apnea, cessation of the respiration. Suddenly, the next moment, the patient starts heavy respiration, that is the rapid respiration and deep respiration. And this process goes on. This is called Cheyne-Stokes breathing. There is also another type of the breathing that's called Byers breathing. In Byers breathing, there are it is like the Cheyne-Stokes breathing, but with no waxing and waning. There is abrupt cessation and abrupt start of the breathing. Abrupt cessation, no, and there is some apneic levels in it, no respiration in the center. And immediately when the patient starts deep respirations. This mechanism of stimulation and suppression is always there, normally even because your centers are suppressed by oxygen and they are stimulated by carbon dioxide, but this reflex is dampened in the normal people due to decreased pressure of gases in the body fluids. Cheyne-Stokes breathing occurs when blood flow to the brain is slowed down, not necessarily because of the brain damage, but because of some other problems in circulation like cardiac failure. When your heart is not able to pump blood efficiently, the cardiac output decreases and blood supply to all the tissues, including the brain, that decreases. And as other centers of your body, as parts of your body like muscles, they get weak because of the less blood supply. Similarly, the brain centers are also affected and their threshold level increases, so they have to be stimulated by too much accumulation of the carbon dioxide. And this in brain damage is usually a sign of grave consequences because just before death, usually this Cheyne-Stokes breathing starts. Now, as I told you, apnea means cessation of breathing. So this thing can also occur during sleep, particularly when the baby is premature, too young, or the person is too old or too obese, then sleep apnea can occur. Means when the person goes to sleep, their centers have to be stimulated by excessive accumulation of the carbon dioxide. And the spontaneous breathing then resorts back to normal. Mild sleep apnea can be normal. Some people, they sleep very deeply. So this mild apnea, for example, apnea for just 10 or less seconds. This can happen in the normal people as well, particularly if they are obese. But if it is more than 10 seconds duration, and if the occurrence occurs 300 times during night, then it is of course abnormal. One should seek a medical advice in such cases then. The sleep apnea, if it is exaggerated, by exaggerated I mean if it occurs up to 10 seconds per time and during night sleep more than 300 attacks occur, then it is abnormal. The reason for the sleep apnea can be obstruction of the upper airways or the central nervous system damage. Now, how the obstruction of the upper ways can cause it? Certain people are very obese and they have got excessive accumulation of the fats over the chest as well as the neck, which causes a slight obstruction. These people usually are prone to such type of sleep apnea. This is usually accompanied by snoring. The noise is made during respiration while the one is asleep, and suddenly the patient wakes up. The snoring starts slowly, and then because the fat accumulation is also in the pellet and that is heavy, that also droops down, and during forceful and stronger respiration, the pellet moves and produces a sound, snoring. Snoring becomes louder and then weaker, that also waxes and wanes. And this is also a problem for the neighbor as well. The one who shares a room with such a person is usually disturbed apart from the patient as well. The patient may not at times be too much disturbed. The patient and not, at times may not be too much disturbed, but the friends near to him and sometimes the relations are also disturbed because the snoring cannot be checked. And such a person who has this sleep apnea and other problems, they are usually, because of their disrupted and fragmented restless sleep, the next day they are not that alert as the other people are, the normal people are. So this fellow usually is then drowsy during the day with poor concentration over his work. And such a person is also subject to increased sympathetic activity. And you know, increased sympathetic activity means increased heart rate, means tachycardia, increased breath rate, tachypnea, increased blood pressure, increased secretions of the adrenaline and noradrenaline, etc. Now, all these may lead eventually to the cardiac abnormalities, heart problems. They are also subject to pulmonary hypertension. एक तो standard hypertension है, essential hypertension, blood pressure, rise of the blood pressure in the systemic circulation, but there is also pulmonary hypertension in the pulmonary area. And when pulmonary hypertension occurs, the right side of the heart, the right ventricle, which pushes blood into the pulmonary bed, pulmonary capillaries, that faces a lot of problem. Heart has to exert more. Ultimately, the right side of the right side ventricle fails. It's a risk. As I told you, that obese people are more prone due to fat deposition in the neck area as compared to the normal population. But remember, this is not the only reason. You can come across thin, slimy person as well who can have this sleep apnea and periodic breathing. This fat can be removed with weight reduction or surgical removal of the fats. as discussed earlier, that it's not only the local change, the reason, the cause might be central as well, some derangement in the brain. But result is the same, that is decreased oxygen, increased carbon dioxide, causing hyperventilation or rectification. You can make a picture in your mind when the person is not breathing properly, you know that he will or she will not be able to take in oxygen much and will not be able to exhale carbon dioxide much. So carbon dioxide will start accumulating in the blood, which when reaches to the brain, that causes hyperventilation by stimulating the centers over there. Similarly, deficiency of oxygen in the blood, when it reaches to the brain, that is also a stimulant for the stimulation of respiratory centers. And for rectification, they have to ventilate, to breathe deeply and rapidly. When you breathe deeply and rapidly, it is called hyperpnea. When rate and depth are increased, it is called hyperpnea. When only rate is increased, it is called tachypnea. On the same analogy as tachycardia, when the heart rate increases, we call it tachycardia. And when the tachos means rapid, neo means breath. So when the rate of the respiration increases, we call it tachypnea. Opposite to it, slow rate is the bradypnea. There is another condition called polypnea, but that is usually not found in human beings. It's like gasping by the dog. Rapid but shallow respiration. Rapid but shallow respiration. And the normal respiration is called eupnea. Eu means normal. EU. When we say the person is euthyroid, it means that his thyroid gland is normal. Eu normal. So eupnea, normal breathing. Normally breathing 500 cc of the air, inflating your lungs at a rate of 14 to 15 breath per minute. This is eupnea. And apnea, complete cessation of the breathing. This is called apnea. Sometimes complete cessation occurs for a while, for example, during deglutition. When the person is eating, the moment the bolus is swallowed and when it approaches the pharynx and larynx area, there is sudden cessation of the respiration with closure of the glottis over the larynx so that the food material may not go to the respiratory passages. To prevent that, there is shutting down of all the pathways at this level, and we call it apnea. Since it is during swallowing, so we call it swallowing apnea or deglutition apnea. Similarly, apnea can be produced voluntarily as well, but as I told you, not for more than a minute or so. One has to expire then. There is another condition called hypercapnia. एक मैंने बताया hyperpnea, increased rate and depth of the respiration. और एक है hypercapnia, which means increased accumulation of the carbon dioxide in blood. It is related to the gas carbon dioxide. Hypercapnia. Then specific pulmonary diseases, out of which pulmonary emphysema is one of the common problems, one of the common. There are also other problems as well, but one of these is the pulmonary emphysema. Emphysema means Latin word है to inflate, to expand. So in such cases, the lungs are overinflated. The lungs are overinflated. How are they overinflated? Because the air which you inhale, some of it is retained in the lungs. There is constant accumulation of this air which causes overinflation of the lungs. The term is actually used for obstructive and destructive processes in the lungs caused by cigarette smoking. Now, the cigarette smoking or the chillum smoking is injurious because they destroy your cilia, and cilia are responsible for removing the mucus from the lung passages and from the alveoli so that the passages be cleared. But due to destruction of the cilia by the smoke of the cigarette, the mucus starts accumulating over there, which invites infection by the bacteria. Frequent and constant infections over these areas, ultimately damaging the alveolar walls. You know that alveoli are separated from one another by walls. So if the walls of the respiratory alveoli are destroyed, then a number of the alveoli fuse together to become one big alveolus. But the surface area is definitely decreased. When the surface area is decreased, there will be less transfer of the oxygen and carbon dioxide, the gases I mean. Less oxygen will be absorbed and less carbon dioxide will be exhaled. That cannot go out easily. The result is that respiration is badly affected. All the time, such a person coughing, producing sputum, very difficult to take it out. And the overinflated lungs, they also distort your chest cage as well. Your chest cage, which is flattened in front and at, and behind normally, with bulging in the centers, that becomes absolutely barrel shaped, means the internal diameters all the way they become increased, and the chest cage becomes like a barrel. As I told you, cellular destruction, mucus collection, this is the process which results as destruction by the smoke, resultantly mucus collection because mucus cannot be taken out inflammation will disturbance of the anatomy. And all these changes, they lead affection of the heart, causing heart failure, particularly the right side heart, right ventricular failure. The poor patient is lifelong dyspneic. Both frequency of infection, frequent infections over there, ultimately death is the answer. Another condition of the lung pathology or lung abnormality is the development of pneumonia. Pneumonia means inflammation of the lungs. It can be acute, like one caused by bacteria, pneumococci, viruses, one type nowadays very dreaded is the coronavirus. Similarly, other viruses as well. And the infection can be chronic, slowly developing, and slowly killing the person, like tuberculosis. Also very common in developing countries, particularly in our country. This infection in the lungs causes accumulation of the mucus. The same pathology starts repeating, and with the accumulation of the mucus, there is growth of the bacteria, culture of the bacteria over there. And in this way, the infection not only continues, but it spreads to the neighboring alveoli. And ultimately, there is slow outpouring of the mucus and the blood cells and the bacteria, where the area becomes consolidated. That becomes solid, which gives you definite clinical picture when you hear with a stethoscope. And also, then it is shown by the X-rays as well. Now, whenever there is consolidation, it means that the lung portion, instead of having alveoli, and they have become now a solid tissue. So no oxygen and no gas can go through this area. And the rest of the normal portion of the lungs has to take this responsibility to increase the exchange of gases. But that also becomes impossible. And ultimately, there is decreased oxygen and increased carbon dioxide accumulation. This can be fatal if not urgently treated. And the treatment is with antibiotics, proper antibiotics, suitable for those bacteria, means specific against those bacteria or viruses, and other supportive therapy like oxygen, analgesics, etc., have to be given to such patients. Then, before going to atelectasis, I would like to mention another common condition. There's the bronchitis. Inflammation and infection in the bronchi by bacteria is very common, and when it becomes chronic, long-lasting, not responding to treatment, then we call it chronic bronchitis. Chronic bronchitis then is the main problem. Rest of the pathological changes, histological changes are the same as in other infections, pneumonias, etc. But of course, not that grave as those of the pneumonia and not that acute. But the person is constantly producing sputum, excessive sputum containing pus, having slight fever, sometimes affecting other systems of your body as well, causing anorexia and feeling of illness. Now we go to the fourth factor, that is the atelectasis. Ati, atili means a Greek word imperfect. It means not complete. Atili. Ectasis is also a Greek word which means expansion. So the whole word atelectasis means imperfect expansion. What imperfect expansion? Yeah, expansion. Imperfect expansion of the lungs. The lungs are not fully open. They are collapsed. And this collapse might be of grave degree, for example, complete collapse of the lung. There is no air over there as well. So the lungs lying over the bronchi collapse. The collapse can be of the whole lung, or that can be of one lobe or two lobes of the lungs, depending on the severity of the condition. Why does this collapse occur? This can be acquired or this can be congenital. By acquired, we mean that the person develops the disease later in life, as against to congenital. Congenital means, con means together, genesis means production, means the disease and the baby are produced at one time, congenital. So in such cases, the baby is born with a electric lung, with a collapsed lung, usually both. In babies, it is a very grave condition. I'll explain it later on, and that has to be treated urgently, otherwise definite death. Now, as I told you, the obstruction of the pathway can be from within, for example, accumulation of the hard mucous material or inhalation by chance of a foreign body going into one bronchus and then the bronchioles and causing complete obstruction of their lobe. Or it can be pressure from outside, for example, a tumor which is growing outside the bronchi and pressing over the bronchus, ultimately causing its obstruction. When obstruction occurs, the communication between that part of the lung and the external air, that is blocked. So whatever air is there in the lungs, that gets reabsorbed by the blood. And when air goes out, the lung starts collapsing. So in this way, the collapse can develop. The whole anatomy is disturbed in such cases. And remember, whenever anatomy is disturbed, your normal defense mechanisms, they go out. So you are more prone to diseases like infection and some other mechanical problems as well. Now, when the lung collapses, definitely the blood vessels will also be collapsed, suppressed by the collapsing lungs. So the right side of the heart will start failing. Any pulmonary hypertension and right side heart failure starts occurring. Now, this is something above the absence of oxygen. Oxygen भी नहीं मिल रहा. Further, it is also disturbing your heart. Similarly, another condition, जैसे मैंने आपको बताया कि in babies particularly, there is developmental deficiency of the surfactant. Surfactant is that chemical material which lines the alveoli in every person, decreasing the surface tension of the fluid over there. Fluid causes surface tension, and surface tension tries to collapse the lungs. To decrease that, nature has provided you with a surfactant, that chemical material which decreases the surface tension of the alveolar fluid and preventing them from collapse. So when there is absence of the surfactant, congenital defect, the baby has not developed it, then collapse of the lung will occur and the baby when born, and when the lungs should expand for respiration, they cannot. Now this is an acute medical emergency, and nowadays synthetic surfactants are also available. They can be administered forcefully into the lungs and removing the deficiency of the surfactants in this way. Then another very grave, dreaded, and troubleshooting problem, that's the asthma. Almost up to 5% of the people usually experience it during lifetime. It's a spastic contraction of the bronchioles, the muscles of the bronchi. They go into spasm, causing constriction of the lumen of the bronchi. And you can imagine when the lumen of the bronchus becomes smaller, less gas transaction through it will be possible. Less aeration means less oxygen supply, and similarly, less carbon dioxide expulsion. Remember, the respiration, which is composed of two parts, that's the inspiration, taking the breath in, and expiration, taking the breath out. These are the two different processes. In asthmatic conditions, it is usually the expiration which is difficult. So the person feels difficulty in expiring the lungs, the air from the lungs. इंस्पिरेशन में कोई खास तकलीफ नहीं होती in such patients. Most of the cases below 30 are allergic in nature, means these patients are sensitive to certain pollens of the flowers or the dust particles, mites, etc. So whenever they inhale unknowingly these products, the irritant bronchiolar muscles, irritated bronchiolar muscles go into constriction and causes an attack of asthma, which usually is relieved soon after the removal of the causative agent, but sometimes it is not possible and the person remains asthmatic throughout his life. As I told you, below the age of 30, it is the allergic in nature. Above 30, the irritant can be smog. Smog, you know, it's a combination of smoke, particularly with the fog. Combination of smoke and fog. It's called smog. You can see it on the highways, on the roads, particularly in the winter when the temperature is low and pollution of the air is more. For example, in the area where the factories are running, so smog develops over there, and it not only affects your travel by occluding the vision, but also damages your lungs if you are subjected to it for a prolonged time. In such cases, in allergic conditions, immunoglobulin E are developed and which are lying over the mast cells, and whenever the stimulus means that agent which is called the allergen to which this allergy has been developed, when they come in contact with the IgE, the mast cell is stimulated and that reacts and starts producing histamine. Marked release of the histamine, also leukotrienes and bradykinin. There is a mass release of these things which causes bronchoconstriction. These are all agents or causes of the bronchial constriction with increased mucus secretion and dyspnea, means labored breathing. Expiratory, as I told you, is more difficult. Now, in such cases, you know that when the person starts exhaling air forcefully, the alveoli all around the bronchioles, they exert pressure over the bronchioles and the bronchioles, they collapse. Their lumen further narrows. That's why the exhalation is difficult as compared to the inhalation. And when it becomes chronic, ultimately destruction of the alveolar walls, alveolar partitions, these are destructed, which we discussed a few moments ago under the heading of emphysema. This is emphysema. And one of the common chronic infections is tuberculosis of the lungs. Any part of the body can be affected, but mostly the lungs. Common in the developing countries like ours, where poverty prevails with imbalanced nutrition, decreasing your resistance to infection. The causative agent is the acid-fast bacillus called Mycobacterium tuberculi. Usually affects the apical areas of the lungs, clearly seen on the X-rays. But in diabetics, any part of the lung can be affected. Sometimes you diagnose diabetes or suspect diabetes when a person with pulmonary tuberculosis comes to you in areas other than the apical areas of the lungs. So even you investigate, the person turns out to be diabetic as well. The body defense mechanisms, they try to curtail the infection and to control it and not to allow it to spread. So develop fibrous tissue around the infected area, and this area is called a tubercle. As I told you, it's a chronic infection which may lead to so many complications, starting from profuse bleeding called hemoptysis, expulsion of blood in the sputum, hemoptysis. Similarly, the lungs can also perforate, or if the bronchus is closed, the lungs can collapse. These are all complications of the tuberculosis. And yet another, it can spread not only to other parts of your body, but you are the constant donor of the tubercle bacilli for the society as well. It's a chronic debilitating disease which makes you extremely emaciated, proteinless. Protein mass is also wasted. And this wasting is called phthisis. That's why the tuberculosis initially was called phthisis as well, starting with P, phthisis, debilitating disease. It has to be treated with specific antibiotics, particularly meant for this, like rifampicin, streptomycin, etc. the patient has to be put on good diet and preferably isolated, but not nowadays needed because they become, when they are started with the specific antibiotics, they are not infective to others. Complications, I told you, there's a hemorrhage, superadded infections, and spread to other areas, etc. With this, I finish the lecture. Thank you all.